I'm really grateful to all of you for sharing these very special moments or experiences that you've had in your life. I think it's a very special gathering where we, as Margaret said, as healers, can sit around and talk about it because I think we've all had similar experiences in our life. So our next storyteller is Dr. Jafar. She's a PG2 at Capital Health.
Good afternoon, everybody. My story is about communication, connecting better with our patients, especially the unusual ones. It was few months in my second year as a resident when I met the patient that has changed me. It was the last hour of my shift when I had a new admission, a patient with a disability, mental challenge, and many other comorbidities coming from a group home with shortness of breath and fever. I looked at her and I see a sad, tired face, a bruised knee, which seemed to be an old fracture that did not heal very well. But the worst part of my patient is not all of that, is that my patient did not have a voice. She understood my words, but she was unable to communicate. Later, she pointed to her bag where we pulled an iPad. After a struggle, she was able to call someone, her sister, Barbara. She told me about her medical history and the fact that she is afraid she was not treated very well in the group home setting she was living in. As a resident on the case, I've seen Shayla every morning, and I learned how to talk to her via the iPad app. And I talked to her sister Sue through the same device. It was fascinating to me, and it's incredible what modern technology can do. But more importantly, it did its job of giving Shayla her voice. For most of the part, however, as my patient was not strong enough to pull the bedside device and ring the bell to ask for her pain medication, among her other needs, it was hard to help her. I realized I cannot treat her like my other patient. She's not like the textbook. She's different, and we needed to be treated differently. Days went by, and I became more familiar with her and more familiar with using the iPad app. And one day, her sister Barbara, who was usually talking to us through the iPad, through a Skype, she came to visit, and I get to see her for the first time. It was the first time, despite being 10 days of being her doctor, it was the first time for me to talk about her, not her disease. I knew about her favorite food and that she did not like the hospital food too much. I knew about her favorite TV shows and that in spite of her disability, she's a happy person because she's a woman of faith. I realized that I became a fan of her, and I looked forward on seeing her every morning until a bittersweet moment came and a new placement was found for her. It was the first time I see her afraid. But I knew her. She was strong and always smiling, and she told me, if I don't like the place, I'm going to come back and I'm going to find you. I smiled at her as they wheeled her away and waved goodbye. 2 days after that, I ran to her sister as she was picking some of her meds from our pharmacy. I asked her about Shayla. She gave me a big hug and told me that Shayla is better, and she told her that I am her new friend since she was hospitalized under our service 2 weeks ago. As I walked back to the on-call room, I began reflecting on this word, friend, friendship. I realized that caring for her, helping her find her voice, and smiling each morning was the only part of my day that required little effort. It was also the only part of my care not mentioned in the textbooks. My attending was always teaching us to make friends with our patient, but it was the first time I understand how. Friendship. I cherished the word and felt humble with the trust that she given to me. I will always remember Shayla. She changed the way I see patients. I thought I will always read and try to improve my skills as a clinician. I've already learned the most important aspect of being a physician, caring for the patient. I learned that each day patients expect many things from their doctor, to be compassionate, kind, understanding, and just simple look at them as a human, not a pathology, which can be as helpful as our guideline-driven treatment. There was nothing more rewarding to me than meeting a patient who, despite their disability, is happy to see me, their doctor. I couldn't reverse Shayla's disability or help her have her voice without using the iPad. But I will carry what I learned from her to the rest of my life, and I hope that I always treat patients with the same reverence I gave Shayla. It is possible, no matter what the outcome, to make a difference in someone's life.